Now we're going to move into reading. And reading, is another area where the rote skills tend to be stronger. The rote skills of phonological decoding may be stronger for many people with autism. And in fact, this may be an extreme strength area, and we tend to call that hyperlexia. They tend to do more poorly on reading comprehension tasks. And reading comprehension gets into my ability to summarize and think about and process the information that I've just read, not just to read the word. Now, we will see some more difficulties reading the motives and goals and really the deception that goes on in a particular reading passage. So it's very important to take this into account when we're making judgments about somebody's reading comprehension, particularly as we're making modifications to how somebody may be having to demonstrate their reading comprehension. But I do want to stress again here that there can be some tremendous variability in skill development and performance. So we may see individuals who are very strong in their comprehension skills. So I don't want to, throughout this whole presentation, overgeneralize. But these are some broad patterns, and I do want to make sure that we are pointing out the broad patterns. Now, we're going to move into looking at some of how those three theories we talked about earlier actually impact on reading. And the first one is theory of mind, and really we're getting into how does the person with autism really interpret the perspective of individuals in the story. And this can make it very difficult, particularly again in the language arts areas and the social studies areas, to really value and appreciate the different perspectives of different characters and different people throughout history, and to use the context of the period of the time that's being described to make some judgments about what those people are thinking, feeling, etc. They may also have difficulty switching perspectives from different people. So many different characters can be in a story, and they may have difficulty shifting perspective from one character to the next and what they may know versus what the first character might know. Now, in the area of executive function, we may see some difficulty really accessing and bringing forward background information to be able to actively process the information that I'm currently doing. This is really key for when I'm doing things like when I'm trying to take into account others, the area of science particularly, or the area of mathematics. These really require that I access my background knowledge and that I apply this to the text that I'm currently reading. It is also something that affects me when I'm really trying to hold all this information in mind that I'm currently reading, and I'm trying to store this for later information. And that's frequently what we're attempting to do when we're doing a reading task, is really take this information in and apply it. And the final area I'm going to talk about related to reading is really this concept of central coherence, and this is the third theory. And that may be that, again, there may be a focus on the detail-oriented parts, and they may struggle more with the rote fact. They may get the rote facts. They may struggle more with the big picture. So again, they may not be able to understand that we're supposed to take those details and turn them into a coherent whole. Okay. Now we're going to switch to the area of mathematics. And in the area of mathematics, it's commonly thought that individuals with autism are very strong in their mathematics skills. And so they tend to do well, or there's a tendency to do well in mathematical calculation or computation. Where we can see more difficulties are really as we start to get into more complex mathematical concepts. And that's because math inherently is an abstract concept. And as we're progressing along in our mathematical understanding, we're starting to move where now we don't go just left to right, which is our typical way of reading. But now we may have to start in the middle and then move to the left or the right, depending upon the symbols that we're seeing. We may also have some difficulty because now we started to substitute letters for numbers or other symbols for numbers. And we may have problems when it just comes to overall problem solving, particularly as we move into word problems. So we may have difficulty actually processing all of the information in a word problem. Now, there's also reading for meaning in mathematics, and this gets into the concept of both word problems, but also the more complex computation that's done when we move into algebra and geometry. And when we look at this, there's really a constant process of predicting things in our head and really asking ourselves, am I right? Am I doing this correctly? And if I'm not, how should I reprocess this? Some individuals with autism will struggle with that, and they'll struggle bringing up past knowledge about how they do things to be able to help them right now. And we may see some individuals having particular holes in their mathematical abilities. So they may, and as our executive director Stan likes to say, mathematics really requires a solid foundation that you build upon. They may have holes that make it very difficult for them to move up in their skill. And again, as we talked about, problem solving itself may be a challenge for some individuals with autism. So doing math problems may be a challenge. We're going to wind up just talking about some stuff about brain patterns. And these are just, again, some generalities, but I wanted to highlight a few different areas. And one is that we may see some underdevelopment of connectivity of neural systems. And what this means is things may not move as fast. And so when we talk about a slow processing speed, we're really talking about a slow speed of information moving throughout the brain. Okay. So we may also see some of the areas, and on some studies of the use of abstract words, we actually see very little activation of the parts of the brain that we as neurotypical individuals activate when we're using and understanding very abstract concepts and words. There's an underactivation, or the brain just isn't lighting up around those abstract words the same way. And then the brain doesn't work in synchrony or harmony as readily. And again, this gets into some of that underdevelopment of connectivity. Now, I had mentioned there are some different neural mechanisms that are also used. And this may be why we see some differences in performance under certain situations. So when someone's calm and they have a lot of time, they may actually show some pretty good sentence comprehension. They may have a much more difficult time understanding sentences or phrases when they're stressed or they're being asked to do something in a timed fashion. And this is what often can happen during testing, is that they can't activate these systems as readily or as quickly because the reserves or the brain, the parts of the brain that are being used are less efficient to do so. And finally, there may be a use of some different neural mechanisms, as we were talking about. But when we talk about visual, we've talked about this being a strength. This might be a strength because they're actually not having to use language to try to interpret the visual that they're seeing. And so they may be using a lower level visual mechanism. And again, this may be a strength because they don't have to try to figure things out using language. It can make other tasks more difficult for them that require them to reason using language. So it's just important to recognize in this slide that, again, there are going to be certain strengths for many individuals with autism. We want to build on those strengths. We want to help them to utilize the strengths that they have in their thinking patterns, while at the same time helping to bolster or develop some of the areas that may be weaker for them. Well, thank you, and thanks for listening to this discussion on thinking and learning patterns in individuals with high-functioning autism and Asperger's syndrome.